Hello dear listeners, today I'm going to talk about a very interesting remedy. Its name is Bacillinum. Bacillinum is a broad spectrum no-sword. I would say Bacillinum is more frequently used in my practice than tuberculinum. One of the reasons why Bacillinum cover more broader spectrum is because Bacillinum was made from tubercular bacteria and other bacterial strains, while tuberculinum is made only from tubercular bacteria. That's why Bacillinum covers or effect on broader range of conditions. Let me share my experience with Bacillinum. Firstly, of course, Bacillinum is used in lungs or respiratory conditions. Patients who benefit from Bacillinum often suffer from recurrent chest infection, sore throat, cough and wheezing and rattling sound or mucus in the chest. But Bacillinum also used in the dry cough or spasmodic cough as well, sometimes triggered by the tickling in the larynx. And of course, sometimes it's due to the chest infection. Its patient has this tendency to catch cold frequently and easily. It has symptoms similar to antimonium tart, hydritis, and kali carb. Recently, a homeopath contacted me about a patient with hydritis-like symptoms. She had been prescribing him hydritis, but it only provide a temporary relief from his catarrh or this cough. I advised her to give one dose of Bacillinum first, followed by hydritis, and it clears the case. This is why Bacillinum is not just a primary remedy, it also works as an intercurrent remedy in many infections, helping to break the cycle of recurrent infection. Now, I also use this remedy in chronic or recurrent infection, as I said. If the patient relapse, especially due to infections, in those cases, Bacillinum can be very helpful. Furthermore, as you can see in this case, that if the condition or the symptoms keep coming back, or in homeopathic way, you call it a relapse in the patient, especially due to infection, use Bacillinum in those cases. Here I want to give you another very helpful tip. If the patient complains that he's getting infection with a high fever after every few days, give one dose of morbillium as an intercurrent remedy and see the difference. Last winter, morbillium worked wonders for me, especially in treating children who suffers from frequent fevers. His children get fever after every few days, and parents complain that since the infection, he never put on weight. Instead, he lost weight and always feeling weak and lethargy. In those cases, try morbillium, just one dose. I often give 30 potency, but you can also give 200 in those cases as well. Keep in mind, I have made a separate video about morbillium. I have shared a very interesting case of morbillium. Please go to my channel and watch that video. Now let's move on further. Last month, a homeopath contacted me that her patient has a typical cancerous UTI like symptoms, but it only working like 30 to 40% relief in symptoms. Could you please advise what to do in that case? I advise her to give one dose of Bacillinum first and then give cancerous. Although I often use Bacillinum for UTIs, but when it's unavailable or when I'm not sure about the bacterial infection, then Bacillinum is an excellent alternative. I sometimes also use Pseudomonas no-sword, but Bacillinum is my first remedy to prescribe in those cases because it covers the broader range of bacteria. Then there is another bacteria which is Klebsiella, which is also sometimes responsible for urinary tract infections. By the way, I have also made a separate video about UTIs and Bacillinum and its typical symptoms. Please go to my channel and watch that video about Bacillinum. As I said, Bacillinum is a broader spectrum nosode. It will not only work with the lungs related issues, but it also work in different other conditions like abdominal issues where the patient got the history of stomach or intestinal infection. Keep in mind that it's a remedy used in mesenteric or lymphatic issues as well. Let's say if the patient come to me with LOs or carbovig-like symptoms, then or he has the history of stomach infection or diarrhea, then I give first Bacillinum and then give carbovig or indicated remedy. Even in severe diarrheal condition, I often give Nux vomica first remedy followed by a Bacillinum, because Nux vomica antidote the effect of the spicy food or anything what you have eaten, and Bacillinum is the antidote of different kind of bacteria, and then you give the indicated remedy, and it works wonder in my practice. Whether it's a LO symptom or crotalus or croton tig, you just follow this pattern and you will see the difference. I also use Bacillinum in female-related issues like dysmenorrhea or leukorrhea or even fungal infections. But sometimes I also use Candida if the fungal infection is very prominent in the case as an intercurrent remedy. But Bacillinum cover broader picture in most of the cases. One very important point here to note. If the patient of the Bacillinum patient keep relapsing, then give one dose of tuberculinum, which boosts the whole case, which actually stop the relapsing of Bacillinum cases. Then I also use Bacillinum in the cases of developmental issues. My first mentor, His Holiness Hazrat Mirza Tahir Ahmad, always include Bacillinum 200 in cases of dwarfism or developmental delay. I have seen almost in all of his prescription, he prescribed Bacillinum 200 in all the height related or dwarfism cases. That's why in my practice, I also use Bacillinum in almost all the cases where I can see that developmental issues are very prominent. Keep in mind, Dr. Ali recommended tuberculinum in the cases of dwarfism or delayed development or developmental issues. So keep in mind when treating such cases that Bacillinum or tuberculinum, they both have this delayed or developmental issues. Now, Bacillinum is a versatile and a powerful remedy that can be used in a wide range of conditions, from respiratory and digestive issues to the chronic infection and developmental issues. Whether used as a primary or intercurrent remedy, it plays a key role in homeopathy. I hope this discussion has given you a valuable insight into using Bacillinum effectively. But every case is unique, of course, and selecting the right remedy at the right time is crucial. If you have any question or need personalized guidance in your homeopathic practice, feel free to reach out. I'm always happy to help and share my experience. Let's continue with the learning and growing together in this fascinating field of homeopathy. See you next time with another video. Bye.